Talofa, I'm Mandy.
I'm Alex.
And I'm Piper.
We've chosen to do scenario 1 for our assignment, which is Mr. Lafayette. We hope you enjoy.
Step 1. Identifying the problem. Nathaniel Lafayette is a 79-year-old male. He has recently been admitted to the medical ward in the city. The patient is of Samoan descent and has a recent history of deteriorating attention span, forgetfulness, sleeplessness, and frequent confusion. Nathaniel has been wandering the ward at night and disturbing patients by having conversations with them and rummaging around their bedside cabinets. The first problem that we have identified is that Nathaniel has a recent history of deteriorating attention span, forgetfulness, sleeplessness, and frequent confusion. The second problem is that Nathaniel is wandering the wards at night. The third problem is that he is disturbing other patients at night when he goes into their rooms and through their belongings. The fourth problem is that staff are conflicted how to respond. Anna thinks he should be restrained and the house surgeon should prescribe a strong sedative, whereas Brett, the other registered nurse, disagrees with Anna's decision to restrain Nathaniel. Our final problem is that there is uncertainty about Nathaniel's future care plan. Will he move to another ward? Will he return home? Or is he returning to a rest home or awaiting placement? The most significant issue is Nathaniel being unsettled at night time. The two nurses involved have different opinions on how Nathaniel's situation should be handled. Step 2. Gather facts. Nathaniel has been admitted to the medical ward with a medical history of deteriorating attention span, forgetfulness, sleeplessness, and frequent confusion. Although we cannot confirm this, studies have shown that these are common signs of dementia. Dementia is a general term for a decline in mental ability severe enough to interfere with daily life. Currently, there are no specific tests to diagnose dementia. However, medical history, physical examination, lab tests, characteristic changes in thinking, and day-to-day function can help. Nathaniel appears to be more restless at night as he frequently wanders around the unit disturbing other patients. 3 common causes of confusion in the elderly are urinary tract infections, dehydration, and anesthesia, which reiterates the fact that Nathaniel's confusion is more likely to be due to dementia. Nathaniel is a 79-year-old man and is of Samoan descent. Some important values and beliefs of the Samoan culture include family, genealogies, chiefly systems, church, and other family obligations. Nathaniel's values and beliefs may be impacted while he is hospitalised, as he may not be able to partake in some of his usual cultural activities. This then may cause more confusion and lead to Nathaniel becoming more distressed. As family is an important value of Samoan tradition, it is important that he has good family support, as not only will this help familiarise him with certain aspects of his life, but also have the potential to decrease his levels of confusion and distress. The idea of Nathaniel being restrained may pose negative impacts on his religion, as Samoan culture is known for its chiefly system. Therefore, this value may be diminished as he loses power. Nathaniel has been admitted onto a busy medical ward. The question is this the best place for Nathaniel? With constant movement and noise, this may agitate Nathaniel further and lead to more confusion. The Ministry of Health Restraint Standards states that restraint should be guided by ethical principles that include acting for the consumer's good, avoiding harm to the consumer, avoiding harm to self and others, and respecting the dignity of the consumer and the consumer's human rights. Restraint is a serious intervention that requires clinical rationale and should not be undertaken lightly. It should be considered as one of a range of possible interventions in the care setting. The Ministry also states that restraint should only be used to enhance or maintain the safety of consumers, service providers, or others. There are 2 forms of restraint, physical and chemical. Chemical restraint is used rather than physical to restrain a consumer at risk of harms to themselves or others. Certain medications will be used to restrain patients who are unable to be restrained physically. The Canterbury District Health Board policy states that restraint must be clinically justified and to only occur in a safe and respectful manner, maintaining culturally safe practice under the direction and supervision of trained health professionals. Clinical staff who are dealing with patients' restraint should be practicing competently safe care in relation to restraint minimisation, always considering the least restrictive interventions and appreciating the physical and psychological impact restraint has on the individual as well as their family. The Health and Disability Services Act's purpose is to promote the safe provision of health and disability services to the public, enable the establishment of consistent and reasonable standards for providing health and disability services to the public safely, encourage providers of health and disability services to take responsibility for providing those services to the public safely, and encourage providers of health and disability services to continually improve the quality of those services. Standard 1.3 consumers are treated with respect and receive services in a manner that has regard for their dignity, privacy, and independence. Healthcare providers should be taking into consideration the impact on Nathaniel's dignity and independence if they decide to restrain him, as well as the fact that he is entitled to privacy when healthcare professionals discuss with himself or his family about this. The Human Rights Act is especially important in the healthcare system as it ensures that everyone is treated fairly and equally. Nathaniel and his family have the right to freedom of speech, therefore they have the right to voice whether they agree or disagree with Nathaniel being restrained. Step 3. Identify methods of ethical justification to resolve dilemma. In reflecting on the dilemma, Nathaniel has no clear diagnosis, so clinically there is no best way to handle the situation. Because Anna has been away from nursing for 15 years, she may not be up to date with the current codes and policies regarding restraint. Ethics or the study of ethics do not provide answers on how to handle Nathaniel's situation. However, they do help to provide and help in organising thinking strategies. Each individual should be treated with respect and in a way that is deemed as culturally safe. Culture includes age, gender, sexual orientation, occupation, and socio-economic status. Unsafe cultural practice comprises any action which diminishes, demeans, or disempowers the cultural identity and well-being of an individual. In this situation, nurses are encouraged to reflect on their own cultural identity and recognise the impact it can have on the care they provide and how their values and beliefs may impact on the care for Nathaniel. The Code of Ethics has a set of values that nurses should uphold. These values include beneficence. This is a concept of doing good with the outcome being regarded as worthwhile for the patient. Non-maleficence is the concept of doing no harm. Nurses should be avoiding harm and preventing future harm. Justice is the concept that each individual should be treated fairly. Legal frameworks outline the concept of fairness. Veracity is the concept of communication between individuals or groups which is honest and truthful. Fidelity is the concept of nurses remaining faithful. When making decisions, nurses should consider if they are upholding their nursing values when responding to a situation, as many nurses may breach these values. Being professional. Nurses are accountable for their own nursing practice and have to take responsibility for their actions and decision making. Nurses must be aware of their actions and behaviours and how their moral character can translate into the care they provide.
Addressing ethical issues can be guided by the methods of ethical decision-making, such as consequentialism. The ethical value of an action is not determined by the nature of the action, but is determined by the result of the action or its consequences. In this situation, it is important to think about the outcome for Nathaniel and consider how the action may affect him, but also how it may impact his family and the other patients. Are there going to be consequences if restraint is used? Yes, nurses have to consider the consequences and the undesirable results such as drowsiness and the increased risk of falls if a chemical restraint was used. Deontology. Do we know the best way to manage Nathaniel's situation? No, because there is no clear diagnosis. As there is no clear diagnosis and no clear way to handle Nathaniel's situation, nurses must consider if their actions are ethical and if they are following hospital policies. Virtue. A virtuous person will reason and act in a moral manner. And for a nurse, those virtues include caring, trust, justice, and integrity. Knowing how to respond to Nathaniel's situation is challenging, as there is no clear clinical way of managing this. However, nurses must consider if their actions are compassionate and kind.
Step 4. Clarify relevant values, rights, duties of patient, and self-significant people. As a group, we discuss the experiences we have each had with restraint and dementia patients. Each of us strongly agreed that restraint is not the most appropriate first-line solution to the issue. When considering restraint, healthcare providers should be acting for the consumer's good, avoiding harm to the consumer, avoiding harm to themselves and others, and respecting the dignity of the consumer and the consumer's human rights. We believe the only harm Nathaniel is causing is by rummaging through other patients' belongings due to his confusion, rather than intentional harm. We believe that there are options other than restraint to minimise harm to other patients, as well as reduce Nathaniel's level of confusion. For example, Nathaniel could be transferred to a long-term care facility where he is in a single low-stimulus room, which would reduce the chance of him getting confused and wandering off in the night.
Step 5. Identify if there is an ethical dilemma. For a situation to be considered an ethical dilemma, there are 3 conditions. The first condition being when the healthcare professionals must make a decision about which course of action to take. The second consideration is when there must be different courses of actions to choose from. And thirdly, some ethical principle is always compromised in an ethical dilemma no matter what course of action is taken. This highlights Nathaniel's situation as there is no perfect solution. Nathaniel's situation is an ethical dilemma due to there being no diagnosis. This means that there is uncertainty as to what guidelines and policies to follow in Nathaniel's care. For example, if a patient was intentionally causing harm to themselves or others, this would be an appropriate situation for restraint to be used. However, because Nathaniel is not intentionally causing harm, instead he is causing minimal harm to other patients due to confusion, there is no means for restraint to be used as a way of managing the situation. Nathaniel having no diagnosis also imposes on his medical management of care, as healthcare professionals will have to experiment with different ways in which will be beneficial for Nathaniel's care.
Step 6. Identifying guidelines from nursing and professional codes of conduct. The Code of Ethics is provided as a guideline for nurses who are responsible for achieving ethical nursing practice. In Nathaniel's situation, the nurses have no clear guidelines to follow, as there is no diagnosis for Nathaniel. Nursing takes place in a number of different relationships, including clients, whānau, colleagues, organisations, and society. These relationships are unique and all vary in the ethical values, and the Code provides a framework which can be used to guide nursing practice. The Code of Conduct for Nurses is a set of standards defined by the Council describing the behaviour or conduct that nurses are expected to uphold. The Code of Conduct provides guidance on appropriate behaviour for all nurses and can be used by health consumers, nurses, employers, the Nursing Council and other bodies to evaluate the behaviour of nurses. Nurses are expected to uphold exemplary standards of conduct while undertaking their professional role. The Code of Conduct can be applied to this situation by looking at whether the nurses are upholding the standards set out by the Code of Conduct. Nurses have a commitment to providing safe and competent care and must take accountability for their actions and be able to justify their decisions. An important value is respect, and this includes treating consumers, their families, and also treating colleagues with respect. Treating a consumer with respect includes valuing their worth, dignity, and uniqueness. Another value is trust. Nurses need to establish trusting relationships with health consumers to effectively provide care.
Step 7. Identify and use relevant interdisciplinary resources. In order to decide how it is best to proceed with Nathaniel's situation, the registered nurses involved, Brett and Anna, should seek guidance from senior staff such as the charge nurse manager. As well as this, Nathaniel's nurse should discuss with the multidisciplinary team about his situation. Consulting with the MDT is important in managing this ethical dilemma. Members of the MDT have advice to offer and knowledge to contribute to the situation. The team could also introduce a cultural support person that is familiar with Nathaniel's values and beliefs, as this is an important aspect of his life. Step 8. Identify and prioritise alternative actions or options. Firstly, we would discuss the dilemma with Nathaniel when he is appearing less confused and has the ability to comprehend the conversation. Secondly, we would inform Nathaniel and his family about the different courses of actions, for example, physical restraint, chemical restraint, or moving Nathaniel to a more secured ward that is a better suited environment. Thirdly, we would discuss with Nathaniel and his family about the benefits of transferring to a rest home or a long-term care facility. For example, a rest home would have better resources to deal with Nathaniel's confusion and wandering throughout the night, such as Sensormat single low stimulation rooms and staff who are more specialised in Nathaniel's area of care. Next, we would involve Nathaniel's family and discuss with them if they support or oppose a particular course of action. And lastly, if Nathaniel was to stay on the ward, we'd prioritise with the nurse managers to transfer Nathaniel to a more suited hospital ward for him, and put safety precautions in place, such as an HCA watch and a Sensormat to manage his behaviour throughout the night.
Step 9. Select a morally justifiable action or option. After considering all steps to the ethical decision-making framework, we believe that there are alternative options that should take priority before using restraint as a form of managing his situation. For example, Nathaniel could be transferred to a more secure ward or a long-term care facility such as a rest home. A medical ward is busy, fast-paced ward which would increase his levels of agitation and confusion, whereas alternate options would be more suitable to provide a safer and more specialised care to Nathaniel's situation. We considered alternate options such as transferring him to a rest home to be more beneficial rather than restraint for many reasons. Firstly, Nathaniel is not intentionally harming himself or others, therefore there is no means for him to be restrained.
Step 10. Act. In order for this step to be successful, it is essential for continual assessment of ethical action out of respect for the patient's interests. As a registered nurse, Anna in this situation has just returned to nursing after 15 years away. It is important she is educated on the change in policies and laws surrounding restraint. For example, the Ministry of Health Standards states that restraint is a serious intervention and requires clinical rationale. It should only be applied to maintain the safety of consumers, service providers, or others. The charge nurse manager should be involved in discussing with Anna and the nursing staff that there is no means to physically or chemically restrain Nathaniel, as he is not intentionally causing harm. Following the discussion with the nursing staff, plans should be put in place for Nathaniel's future care, with respect to him and his family's wishes. Nathaniel's situation could be used as an opportunity to educate staff on the Code of Ethics, Health and Disability Services, restraint minimisation and safety practice standards. Nurses with knowledge of ethics and ethical frameworks and processes are better prepared for situations requiring ethical judgments.
Step 11. Evaluate. To evaluate the effectiveness of the interventions carried out, the healthcare team must document progress notes, such as any changes in behaviour and what factors contribute to his confusion. This allows for the healthcare team to have access to continual updates on Nathaniel's progress. It would also be beneficial to regularly update Nathaniel's family as well as discuss any concerns or feedback they may have. In order for Nathaniel's care to be successful, nurses need to continually examine the nature of the ethical decision made and have opportunities to share their own opinion and perspective.
Nathaniel's situation has opened our eyes to the many ethical dilemmas we may be faced with in our future nursing practice. We will be sure to refer to the ethical assessment framework for nursing practice if we are ever faced in a similar situation.
Thanks for listening.